Good morning. It's Angie Oliphant once again from Eden Medical Retreat Lombok, and I decided that it was time we talked about the effects of excessive use of substances, methamphetamines, heroin, alcohol. They're all the same. The effects on the family dynamic is the same, whether it be alcohol or drugs, and they affect your organs. It's just one is considered a legal substance. Alcohol is the most highly abused substance in our society in Australia, and methamphetamine, heroin, opiates, these are all becoming increasingly big problems. Now, Eden Medical Retreat is based in Lombok, and we are treating clients from Western Australia, Perth and Australia, but most of our clients have been coming from Perth. And the reason for this is because Western Australia has such a high ratio of young people and 30 to 40-year-olds taking methamphetamine, and it's causing a very, very big impact on our society. We're getting raising in domestic violence, breakdowns in families, dynamics are changing. Children are being taken away from their parents because they're being abused due to their substance abuse. So they are then going through the courts and landing up either with grandparents, or they're landing up in the foster system, which is really not optimum. Every person that takes meth or any substance can change if they take ownership of their addiction. And this is what we work on at Eden, and we're having outstanding results at the moment. So I just was looking at some stats, and it was just shattering. I couldn't believe how high it was. So 44% of Australians reported that they'd been negatively affected in some way by others' substance abuse related behaviours. Of course, the violence is getting worse, the criminality is getting worse. We're seeing increase in stolen cars and resales, we're seeing break-ins, we're seeing people having bags snatched, we're seeing a lot of criminal behaviour which is clogging up our courts, and we really need to change all this. And I think through education, and this is part of the reason of the video, we need to bring through more education to people so that they know where they can get help. And we are a private retreat. We are not government supported, unfortunately, and Medibank does not, or HBF, assist us in clients being assisted financially to come to us. We don't make any excuse for that. We are a private retreat, but we are getting the results. 1 in 6 Australians use substance at a level that puts them at risk of a substance-related disease or injury over their lifetime. So that is pretty high. Western Australia had the highest proportion of adults who consumed substances. Over 1 million children, this is what really staggered me, 22% of Australian children are estimated to be affected in some way by the substance abuse of others, and over 10,000 Australian children are in the child protection system because of carers' substance abuse problems. And what we're finding here is the risk factors for substance abuse in parents. You know, a lot of them have traumatic childhoods, but not all. And one cannot keep blaming your childhood for your behaviour. So, but it does contribute to people taking substances excessively. Generally, it's because they have either an underlying mental health issue, or they have a very low self-esteem and self-confidence, and they take the drugs to gain control and to make themselves feel better in social situations. They also use it as a coping mechanism and to reduce feelings of isolation and loneliness. Unfortunately, in Australia, we have a very, very poor way of communicating with our neighbours, etc. It's not like it was in the 50s and 60s. Everyone's becoming very nuclear. Whereas in a place like Asia, it's a bit like the Aboriginals, which have a wonderful idea of sharing and being communication. And if there's a problem, the other family member will step in. We are becoming very, very isolated in Australia, and we need to make people feel inclusive, because I think the loneliness contributes also to substance abuse. There's also reasons that people take substances, and this can include a house within households, which causes instability, and that is divorce, parental and mental health issues, frequent undesirable changes in the family life situation, e.g. financial difficulties, frequent job changes, and frequent relocations, which doesn't give stability to children. Up to 69% of domestic violence instances involve substance. This includes domestic violence versus spouses, significant others, and other family members. Domestic violence abuse can be in the form of physical, emotional, psychological, or sexual violence. Children who witness domestic abuse against their maternal caregiver are 50% more likely to abuse substance and or drugs in the future. This is what I talk about, intergenerational effects, which go from the person that's taking the drugs, the children witnessing the poor behaviour, and it's monkey sees, monkey does, and then they land on perpetuating that terrible behaviour. So we need to be able to address this, and I know that in Australia the government is very proactive about domestic violence, but it's some of the triggers that are causing that, and that's generally due to substance abuse, whether it be alcohol or whether it be drugs. There seems to be also contributing factors that substance abuse is found with families that take drugs, and they have lower levels of family cohesion, lower levels of expressiveness, lower levels of independence, and increased family conflict. We're also seeing children who are the result of coming from addiction families or addictive families, or mothers or fathers. They have low self-esteem, and we are finding that a lot of these children develop behavioural problems, and they land up either becoming quite aggressive, or they don't attend school, they will pick fights, they can be vindictive, many reasons, and the only thing that they can actually control is their truancy in some instances. And we are seeing this firsthand at the moment with a client whose son is not attending school. It's the only way he can display his emotional distress, and that's through truancy. So we must address this. Now, there is good news at the end of all of this, and that is when the parents stop taking drugs, so too do the children get better, and their relationships get stronger, their bonding increases, their trust factor comes back. This has to be taken slowly, but the family dynamic can get back on a normal keel. So I think we really have to consider why. Why is this happening in our society? Why is this happening in Australia to such high levels statistically? What is it about Australian mentality that says it's okay? I think a lot of the portion, especially due to alcohol, is the fact that it's normalised in Australian society, and not every individual can handle it. So then we see the flow-on effect, the high raised of health costs within the hospital systems, because we get patients presenting with liver failure, esophageal varices, all sorts of breakdowns that you see, poor nutrition, homelessness, and breakdowns of family dynamics. It is a serious problem, and we really do need to address it. I know the government is trying, but we need to do more. With the drug levels of people taking substance abuse, it is very high. We've got areas in Bunbury, in Rockingham. We shouldn't really marginalise these areas, but unfortunately they've tested their septic systems, and it's very high for methamphetamine abuse. And these are the areas where we are seeing a lot of domestic violence in Mandurah, etc. And I'm talking about Perth. I don't mean there is only this area, and domestic violence occurs in people who have high socioeconomic levels and low socioeconomic levels. So it's the inability to cope. So, you know, I think that we really have to address this, and I just wanted to talk about the impact of parental substance abuse on children's mental health. They get a higher rate of depression, higher rates of anxiety, and more symptoms of generalised stress, including low self-esteem. Now, low self-esteem is not a quick fix. and we have to be able to get people to communicate better. Once people can communicate better and their communication channels are opened, their self-esteem rises. And this is part of our module of treatment in Eden Medical Retreat, and it's proved to be very successful. I think we're starting to see more conduct disordered behaviours in children that's parents take drugs and excessive alcohol. You'll see them presenting lying, fighting, truancy, as I discussed before, and impulsivity. Common emotions observed in children of parents with substance abuse are guilt for being unable to care for the parent or the family, that they view themselves as the cause, anxiety, worrying constantly about abuse and health issues, finance and housing, embarrassment related to a family behaviour in public, fear of intimacy and trust, lack of trust, confusion due to inconsistent parental behaviour and environment. A lot of these children are having anger issues and frustration and depression. So we need to be able to address this and help these children. At Eden, we have a behavioural psychologist who's also an educationist, Dr. Leith Cracker, and he will come and see patients in Australia. He travels all around the world, he lectures at Oxford, and he is absolutely specialised in this area. So if any of you require to contact Dr. Leith Cracker, please contact our website and I will pass on his contact details. And we're, of course, at Eden very happy to work with family dynamics, the whole family. So we discuss not only the person with substance abuse, but also work with the children if they develop or have any of these issues as truancy, anxiety, anger issues, frustration issues, vindictiveness, whatever it presents, we're able to assist in treating. So I hope this is food for thought. My main aim is to say, don't take the drugs. That's as simple as that. Say no. One of the hardest words in the English language is no. But if any of you are offered drugs, don't take it. The fallout effect is catastrophic for the family, and it's affecting Australia socially, physically, emotionally and spiritually and economically. Thanks very much.